I think we are live, so we can start with the session. Good evening, everyone. I'm Dr. Sandeep Sharma. I am the pediatric faculty for FMG, NEET PG, INICT, as well as pediatric residency at Dr. Tutorials. And here, in a very crisp manner, we are going to take up the approach that you should be taking if you are a first-year resident and you have just joined or currently doing your first-year residency in pediatrics. See, pediatrics, it's a dream branch for many of you. And for those who have taken and joined, first of all, congratulations. You have taken a very right decision. Although what happens is in the first year, many times there will be phases in your life where you will feel like, have I taken a right decision or not? Sometimes the toxicity, sometimes the workload, sometimes, people's perception, sometimes the residency itself will get to you and you will start doubting yourself. So don't doubt yourself. It's a wonderful branch, but yes, it is going to be tough. So my point here is I'm going to discuss a few points with you. If you keep these points into your mind, that they will take care of many of your doubts that you have shared with me over the last few weeks. And for those who will be watching this video in a recorded format later, this will be relevant for any of you, whether you are watching it now or maybe you are watching it 1 year later. So the things I'm going to discuss in this video are what to expect in the first year when you join MD or DNB in pediatrics. What is the stuff that you need for residency? What are the resources needed for residency? What is the importance of bedside learning? And finally, the question for which there is no clear answer, when to start preparing for the super specialty exams. Times have changed. When I was doing my MD, pediatrics was more of an end branch. However, as of now and in the coming years, it is no longer going to be an end branch. So you need to decide accordingly whether you will be becoming a general pediatrician or you are going to take that plunge and go towards the specialty part. So we'll be discussing that part as well. So first of all, what to expect in the first year MD or DNB in pediatrics? Remember that first 6 months is the toughest part. It is the toughest part. You may join, first few days will be kind of honeymoon period for you, but after that, the reality will set in. You will have long working hours. You will not be knowing anything. You will try to apply, but you will find that you are unable to apply your existing MBBS level knowledge. Many times there will be people shouting at you, parents expecting from you, and you will get 24 hours and 36 hours duty. So it is going to be tough. Some people adapt immediately, some people take a longer time. My advice to you is take your time, go slow. Despite people saying, hurry up, hurry up, hurry up, take your time. Let them say, hurry up, but you take your time, learn, adapt. Everyone adapts. So it is the toughest part, but trust me, once 6 months of your residency is done, you will start liking the subject even more. So first 6 months is the toughest part if you are mentally prepared for that, because it's a cultural shock, it's a professional shock for you. If you are able to overcome that, then the residency becomes more like a breeze later on. Second thing is long duty hours. You need to watch for your health. There will be long duty hours in pediatrics, so you need to watch for your health. Don't skip meals. Don't overdo or underdo your caffeinated beverages. Stay away from too much of fast food. Stay away from mess food, although it is not avoidable entirely during your residency. And wherever possible, carry your own water bottle and make sure that you're taking the probiotics, and all the relevant antipyretics and antibiotics are always there in your kit, because you need to watch out for yourself as well. Later on, you will learn it, but first few months, it is going to be tough for you. Develop a respectful relationship. This is where a lot of students falter. They tend to think that I've entered into MD or DNB and, somebody is going to make me sit and make me teach pediatrics. No, it's always a passive learning. And here is the role of people around you which comes into play. If you're respectful to your seniors, although it is not a very strict hierarchy compared to certain branches like orthopedic surgery or neurosurgery, but in pediatrics, still in an Indian system, hierarchy works. And your seniors, they see there will always be toxic people around you. There will always be occasional toxic junior resident, senior of yours. There will be occasional nursing staff who's unfair or maybe passing sarcastic comments on you. There will always be a odd SR. There will always be not one but many consultants who will be passing remarks on you that you're not good for this job and you are taking life too easy. You need to take it in your stride. This is time for you to learn the skills because you are now dealing with life and death of young children. Children are wonderful patients, but they also become unstable very soon. And they improve with therapy very soon. And there is nobody going to make you sit and learn. You will have to learn from your surroundings. And this is where the role of your seniors. Suppose you're having a bad day. Suppose you're having a bad health. And if you have good working relationship with your nursing staff, with your seniors, with your senior residents, trust me, it is going to be much more easy. So small little things will matter. Even if someone passes a rude comment, take it in your stride. Someone's opinion is not going to change your perspective, but at the same time, have confidence in yourself, give a smile, and try to work. Try to, keep on improving and take the feedback in a positive way. It is very, very important. Don't let someone get into your mind space. That is very important. And nursing staff often comes handy, particularly in procedural branches and in emergencies. If you have a good working relationship with the nursing staff, they are very, very helpful. Some people have a tendency of, not paying much attention or having preconceived notions. I'm a doctor and he or she is a nurse. Don't have such notions, and you will find that the nursing staff, lab technicians, they are going to be very, very helpful in your day-to-day learning in the wards and in your clinics. Patience is needed to develop skills. Pediatrics is one of the most patient branches. You need to develop that patience because many times child will be crying and you need to know, you need to have that patience to see, to observe the child and to notice that these are the problems child is having, and I need to learn and wait for my patient to be ready for examination. So patience is needed both in terms of managing the patient and in terms of learning. And at the same time, don't become a totally um, mechanical guy or girl. Try to find time for yourself. Initially it will be tough, but whenever you get time, catch up on your sleep, and maybe 10 minutes, 15 minutes in a day, take out time for yourself. Whatever hobby you have, cooking, singing, listening to some music, whatever, just try to do that. And whenever time is allowed, mini vacations, proper vacation will not be possible for the next 3 years. Throw it out of your mind. But a mini vacation, half a day you get, one day you get somewhere, try to spend time with family, try to sleep, and try to roam around the city that you are doing your MD in. Try to eat good food outside the hospital, not in your hostel or hospital, and you will find that you remain sane. So this is very, very important in the first year, because second year and third year you will adapt anyways. And don't get frustrated by form filling. Now often this will happen to you. People will say, you will start thinking, sir, I joined MD after taking so much of a rank, and here I am since the last 2 months. I'm only filling forms, collecting the reports, and doing documentation. This is very, very important. And in the evolving medical legal system in our country, if you develop those skills, it is a part of your learning, and you will realize how important it is once you are out of an institute and you move into practice or you go into DM. You will realize the documentation skills that you have developed, the learning skills, the discharge booklet skills. These are skills. Yes, they are skills. You might think कि सर क्या फालतू की बातें कर रहे हैं. These are the most important things. Nobody will tell you. Form filling is an art. Report collection is an art. How fast you fill a file without compromising on the knowledge. How fast you collect the reports. Where to send the patient. And how to save time for that chai and samosa in between your collecting the reports. It is a skill. This makes you sane, this makes you practical, and will lead to less frustration once you get the air of how things are working out in your hospital and department. So it is very important, and take some time in learning these skills. Don't, brush them off. Once you are fast in them, once they become a part of your reflex memory, you would love your branch even more. Second thing is, what is the stuff needed for residency? This is bare minimum. Of course, other different medical colleges and different departments and different HODs have different rules. So the stuff which is bare needed, first of all, you will need white aprons. Generally, in most of the medical colleges, you need a full length apron, full arm length apron. But many medical colleges, particularly in the western parts of the country and in the northeast part, they prefer those half sleeve aprons. So depending upon what is the rule, what is the convention at your medical college and department, you go for white apron. Also, many medical colleges prefer students having their name written over there. This varies from department to department. Minimum 3 to 4 are needed because you'll not be able to wash them on a daily basis. And scrubs will also be needed. Get some good comfortable scrubs wherever possible. Carry your own scrubs with you. These days, a lot of good quality scrubs are available. I will not take brand names here because I have not been sponsored by any of them. Then is buy some comfortable non-pricey shoes. Don't go for those Nikes or Birkenstock because if you buy them, they are going to get stolen. Yes, be it your central institutes, be it your government medical colleges, be it your DNB institutes, all the ICUs, all the doctor duty rooms, they are notorious for people carrying their carrying their, those fancy footwear and going away for washroom, and in the next 10 minutes, the footwear is gone. I have suffered this trauma. My juniors have suffered this trauma. You can ask your seniors. If your medical college or your department is a relatively safe department in this respect, you can take your risk. My advice will be not very pricey, but comfortable footwear you need to carry with yourself. Third thing, good stethoscope and always carry. People will say buy Littmann. Yes, I would also say buy Littmann and go for the pediatric Littmann because I don't know. Some people prefer the normal classic Littmann, which you might have used in your MBBS days. Central institutes, particularly PGI, and at least 3 AIIMS, if you are doing pediatrics from there. The HODs over there are very particular. If you are not carrying a pediatric Littmann, you might be thrown out of the wards. Yes, that is how strict the rules are. So it is always better to see and ask your seniors what Littmann is being preferred. The pediatric Littmann is always the preferred one, the one with the smaller bell. And always carry one cheaper one as well, particularly if you're posted in emergency or in OPD and you are carrying it on your around your neck. Somebody will take it and say, 2 minutes mein deta hu, that 2 minutes will never come. There is hardly any guy or girl who has not lost one stethoscope, countless pens, and countless, chargers in their residency postings. So keep them spare. One cheaper one, someone asks you, give the cheaper one so that even if it gets lost, but for your own clinical skills, use the Littmann one. Preferably keep the Littmann one hidden in your bags. This thing nobody is going to tell you, but trust me, the day you lose Littmann, you would say, Sir ne bola tha, I had heard this in one of the video. I should have implemented that. Water bottle is very important. Carry your own water. Hammer and torch, a proper good quality hammer and a torch. Mobile phone torch will not work. Carry a good quality normal torch. Retractable measuring tape is also needed. You can order it from Amazon or get it from the stores which are there around most medical colleges. Get a good quality pulse oximeter and make sure the battery is working. Hand sanitizer, a small bottle you are supposed to carry. Power bank and chargers are needed because you can't take the risk of your phone going out in the middle of your emergency posting. And soft toys and tissue napkins so that you can sometimes kid is crying, you need to distract the kids. So a soft toy, it should be a squeezable toy. These squeezable toys are available in around most medical colleges or at toy shops. You press them, they create a sound. These kind of toys are there. I'm making this sound so that you understand what kind of toy I'm talking about. Because children, a crying child, you want to examine for 10 seconds. You do like this and hand it to the child. The child will be distracted. You will be able to look for the sign that you are watching for or waiting for. And after that it has been handled by the kid, make sure that you sanitize it. Don't let it be the source of sepsis from one child to another. And always carry some good quality tissue napkins also with you. They will be coming handy whenever you are exposed to, sometimes the kids' saliva secretions will be getting in touch. You will be washing your hands, of course, but for immediate, cleaning up the thing, cleaning up your hands, tissue napkins will also come handy. Apart from that, many of the central institutes, pediatrics departments, and many of the good DNB centers in the country, they also like the residents to carry their ophthalmoscope and otoscope. But ophthalmoscope and otoscope, I would say, unless your department is very strict that you have to carry, don't buy them in the first year, buy them in the second year of residency. Eventually, you will have to buy them, and many external examiners in final exam ask you whether you are carrying it or not. And if you say, sir, I am not carrying, there's like, if you're not carrying means you're not in the habit of checking, means they already have a negative perception about you. So always carry your stuff yourself. What are the resources needed for residency? When to buy it is very contentious. Some people say, don't buy anything. I disagree with this. I strongly disagree with this. Earlier, the concept was when I was a resident, People used to say, don't buy because you will not get time. It's okay. You will get time. 10 minutes, 15 minutes in a day in between your wards, round done. You have to leave, finish off your, make those discharge cards. Spare out 10 minutes. Whatever patient you have discharged, if you have a textbook in front of you, read through it. Now, when I'm saying textbook, don't think I'm talking about a physical copy. You can go for an online copy also. So for a quick referral, actually the online resource like an online version of Nelson or online version of any Indian textbook, they are preferable. But when you have to actually read, and I belong to old school in that when you have a physical copy or a physical book, it is always better to read that. So when to buy, it is contentious, but my advice to you is bare minimum 3 to 4 books have to be bought in the first year. What are the books you are supposed to buy? Must buy in first year. Number one, Harriet Lane Handbook. Number two, Drug Dosages book by Dr. Meherban Singh. Both of them are wonderful books and they will be very handy, especially in emergencies as well as in wards wherever you have to do the pediatric drug charting. Second thing is Nelson 22nd edition. There is an international edition now available. So that international Nelson edition has to be bought. If you feel you are posted in emergency right now, you can skip it. Once you go to the wards, I would suggest buy it. It is 22nd edition has been released in mid 2024. New edition is not going to come before 2028. And by that time, your MD or DNB will be done. So buy it now. PG Textbook of Pediatrics by Dr. Piyush Gupta, optional book, not needed in first year. You can go in the second year. It's a good book. It's a 3-volume book. Eventually, it will be needed. Many of the medical colleges, see, reading Nelson. Nelson is a wonderful book, but it is also a difficult book. So you have a patient of, say, infantile tremor syndrome. You try finding in Nelson. You will not find it in Nelson. But that topic will be there in the Indian textbooks. And so Indian textbooks like PG Textbook of Pediatrics or IAP textbook you can go for. These textbooks will be, summarizing that thing for you, and quick reference you can always get. But remember, these Indian textbooks are more useful for answering Viva and for writing in university paper. For learning the skill, there is no replacement for Nelson. Some people ask me, sir, I don't find Nelson interesting. There is no way out. You have to do it. Nelson has to be read, not cover to cover, but at least 80% before you finish your MD or DNB. If you have not done that, your pediatric learning and skills are going to be deficient. Eventually, you will have to do it. Then is your specialty books like Park's Cardiology or all those Dr. Bagga's book for nephrology. You can buy later on, maybe by the year your first year is ending or in the second year. They are not mandatory in the first year. And OP Ghai textbook, there is a 10th edition which is there. Don't buy it unless you are in third year. And national programs reading, those printouts you need to do only in the third year, only for exam perspective. Don't fall into the habit of reading OP Ghai. It's a wonderful book, but it's a book meant for writing in the theory paper. It's not a book meant to teach you the art of pediatrics. And although it is not written here, another book you can buy is Illingworth's Normal Development in a Child. It's a wonderful book to understand the normal milestones and development and reflexes in a patient. And then Indian Pediatrics website, visit the website at least once a month. Try to see what are the new review articles, interesting cases, and just reading them leisurely. It is free for all. You can download the important articles on your mobile phone or your iPad or tab and read them leisurely. Wonderful articles are available. So don't try to read too many journals in the first year. I would tell you very clearly, although many people will disagree with me, my own professors will be angry with me for saying this. Journal clubs are needed in pediatrics. You need to get a hang of it, but they don't make you learn pediatrics much. All they teach you is how to read journals. That is the whole purpose of journal club. Apart from that, they are a big snooze fest, and all you do is, sleep in the, whenever the person who's presenting, that person has to be involved. Other people, senior residents and the third year people are involved. First and second year mostly sleep off. So don't pay too much attention to it. At the same time, don't try to read too many journals. But yes, journal clubs must be attended because reading journals is an art. Are journals needed for cracking the super specialty exam? Absolutely not. Are they needed for cracking your university exam? Absolutely not. But later in life and in your super specialty or in your practice, you will be needing it. And the time to learn the skill of reading journals, how to read them, how to download them, you will be needing anyways for your thesis. That time to learn is the second half of first year. So don't do it in the first 6 months. Second half of 6 months, try reading some journals. You can start with Indian Pediatrics Journal. It's a journal, official journal of the Indian Academy of Pediatrics. And finally, AIMS protocols. There is a 3-volume AIMS protocol. Don't go for the freely downloadable one on the internet. That's the old one. 3-volume set released in January 24 for newborns, that has to be read. And the PICU latest protocol, it's a single thick small book, that also has to be read. That is also needed. So first year, Harriet Lane, drug dosage, Nelson 22nd edition. Optional book is PG textbook of pediatrics, and AIMS protocols are also mandatory in the first year. You have to buy them. There is no shortcut here. Moving further, what is the importance of bedside learning? Now you learn on the bedside. These days, what happens is, and to be honest, I am also a part of many such programs. Now you have online learning programs available, just like you had PG preparation apps. Similarly, now you have residency apps, and Doc Tutorials has a wonderful, wonderful pediatric residency app. I am one of the contributors there. At the same time, we have a wonderful team taken from AIMS Delhi and PGI Chandigarh. Majority of our team is from there. And we also have two eminent people who are experts in DNB preparation. So we have an entire 6-member team. But at the same time, I want to emphasize that learning of pediatrics is always done in a ward. These online resource materials are good when you are preparing for any particular subject, you have a ward leaving or posting coming, or you want to, you're bored of Nelson, or you are not in the mood to read Nelson, but you need a short synopsis. This is where, or you want to, learn the skill of taking history and examination, and you are not very fond of those clinical manuals. This is where these online materials come into play. But the true learning will always be when you present a case in your boards, when you see the files, attend the rounds and clinics, don't take shortcuts over there. Read the files, whatever history is written by your seniors, and try to see what are the points they are mentioning, and then correlate with the theory part once the day ends and you are, going through the case in your theory format. After 5 p.m., mostly by 5 p.m., most of the consultants will be going away except emergency. So spend 30 minutes on reading one case daily. Just 30 minutes on one case. It's a very good practice. If it is a hard day, tough day, night duty is there, you can skip that. Apart from that, those days where you relatively get free early, spend 30 minutes on one case. It's a good habit to develop. Watch input-output charts by the nursing staff so that you understand how fluid management is being done, and also look at the prescription manuals, what dosage is being given, and what is BID, what is BD, what is TID, what is TDS. These terminology you need to understand. Read what you see in the clinics and wards. Don't try to read Nelson from cover to cover. Whatever case you see in your OPD, try to read from Nelson. And also look at IAP STG. You try to do Google. IAP standard treatment guidelines are there, which give you a quick summary of the treatment protocol of common pediatric conditions that you can do when you are posted in OPD. And do try to read Nelson whenever time allows you. And when to start preparing for super specialty exams. Now, there are two types of students. One, students who are sure that I have taken MD pediatrics or DNB pediatrics, and 3 years later, I have to do DM neonatology or DM pediatric cardiology or DM critical care, or they develop this idea in the first few months only, right? This is category number one. Category number two is those people who are not sure and who are like, as time progresses, I will see and decide I need to do it or not. If you are category 1 student, means that you are sure that you have to do super specialty in a particular branch and you are not going to stop at MD and DNB, you have to start early. Starting early does not mean that you start reading and preparing for super specialty from day one. What it basically means is that you start reading Nelson for common things and common topics and start building the concepts early. If you are not sure about super specialty, again, reading Nelson is not going to cause much harm, but you can delay Nelson and focus a bit more on, finding out having those postings across various subspecialties and deciding where your interest actually lies. Starting early gives you advantage, but don't try to overdo it. Why am I saying so? Because first year, especially first 6 months of your MD or DNB, only focus on your 90% of the time should be going in learning clinical skills. How to put a IV catheter, how to intubate, how to put those central lines, how to do fluid charting. Shock management patient comes to you. how to do that, how to do maintenance fluid charting. Where do you give 60% maintenance, 70% maintenance? Where do you give DNS? Where do you give N by 2 5% dextrose? Where you give isolate P? These finer nuances you need to learn. And that, base, if you cover in the first 6 months or so, it goes a long, long way in your super specialty exam preparation as well. There are wonderful programs available, and I myself also have my own super specialty program. Despite that, I will tell you very clearly, in the first year, especially for 6 months, please learn clinical skills. And super specialty preparation, you can pick up pace in the second year, because second year will give you more time. Second year responsibility will be more, but you will have people below you to share the burden of your report collection and other things. So you can focus on your thesis in your second year. Although thesis work should start in the first year itself, but major portion you will be doing in your second year, and that is the time where you can really push the pedal and go for your super specialty branch, whichever you are targeting. And reading Nelson, along with these days online good resources are available. Don't just blindly buy. Try to see what resource simplifies Nelson for you, and that is the resource that you are supposed to buy. As I said, we have doc tutorials, we have PG residency program available with us, with a good 6-7 member team. It's an excellent team. Whenever you are posted in wards, if you are subscriber of that program, we have discussed in details about history taking, clinical examination, common cases. For those in third year, we have OSCE series. Plus, we also have those live programs where we take up various protocols and various guidelines in a practical manner. But again, these things are more of a supportive nature. If you're watching a movie, their role is more of an item song or of a hero's friend. They are not the lead actor or lead actress. Your lead actor and lead actress are Nelson and your patients and your rounds where you actually learn. These are your lead actors and actresses. And those are the ones which matter. If your lead actor and actress is good, your script is good, you are honest, the movie is going to be a blockbuster. The movie is your MD or DNB degree. So focus on what is the most important thing. At the same time, if you get time, try to read Nelson. Start early, but start early does not mean that you start in the very first day. First, develop the skills. First, learn the art of handling a kid. I was very surprised to know that I once visited a medical college. One of the junior consultants over there is my batchmate. It's a central institute. And I saw a first year resident. He was my student. He waved at me. I did not wave back at him because now his consultant is standing with me and I can't get too friendly, right? So I did not wave back. I just went out and I just looked at how he was holding a kid. He was, trying to learn doing Moro's reflex. Horrible. He did not even know. And later on I asked him how much time. So he said, sir, 5 months. I asked, dude, 5 months and you don't know how to hold a young kid, and the way you're doing Moro's reflex is bad. He said, nobody taught me. I said, nobody will teach you. That is where the role of developing good relations with your seniors come in. You read from the books, you read from the online materials, but practice them. And your seniors will correct them. So the point I'm trying to make is learn on the patient. These 3 years, whatever you learn, that is going to make you, that is going to be the base of whatever you do in your life related to your profession. So be honest to your profession, be empathetic, develop those skills, develop empathy. Parents will be asking you, what happened to my kid? Sometimes they will be, bordering on those irritability factor. Understand it is their kid. So develop that empathy at the same time. Be sure and don't take responsibility for too many things. Avoid doing too many loose talk in your first year. You don't know anything. You may have got rank 1 in NEET PG or INI-CET or whatever, but you know nothing about the subject. Whatever you have read in MBBS is a joke. Let me tell you, it's a joke. It is only for cracking the MBBS exam. And I know how you have read your OPGI in your MBBS. I have done my MBBS, I know. And I visit a lot of medical colleges, so I know. Now, these 3 years, you have to start from scratch. Say to yourself, I know nothing, but I'm willing to learn everything. If you have that empathy and that willingness, 3 years down the line, you will be a wonderful, wonderful pediatrician. I've done my mistakes, you will do yours, but learn from other people's mistakes also. And this was more of orientation session. So whether you're listening to this video in 2025 or 26 or 27, this video, the things I discussed with you, they're not going to change and they're going to be equally relevant. So I hope all of you do well. And thank you for your time. I'll not go into much details. You have any doubts, you can always post, and I'll try to post in reply back in the comments section as well. And in case you are thinking of online resources, there are two online resources. Doc Tutorials has a wonderful, wonderful residency program. I am the lead face here. Along with that, we have a team of 6 members from Central Institutes and two wonderful DNB experts in that. So both MD and DNB students are going to get that exposure, clinical exposure, but at the same time, there are also some good super specialty programs. But my advice to you, learn on the bedside. Your patient is your best teacher. Remember that. Thank you so much for your time, and take care, everyone. Okay, Vinod.